Good afternoon, guys. This is Dr. Bhupesh from Dr. BKM Institutes, and today we are going to discuss speaking session in just 5 to 10 minutes. I will tell you all the important points of speaking, and if you will ask lot of people these days, there are many people when it comes to speaking, they have scored not many people. I should not say in a negative way, but there are many people. Sometimes they struggle with speaking and sometimes they get 340 in speaking, and then we do not understand what is the reason that why did I score 340. So today I'm just going to tell you about those things, that why some people even being really nice at speaking miss out sometimes. So I will tell you the important points. First of all, the main speaking tip is to speak confidently, the way I'm speaking right now. The problem is that you keep on passing on gestures like this, like the way if I put gestures like this, rolling my hands, making an eye contact. But in OET speaking, it does not matter. Like you cannot see me now. The final examiner who will assess your speaking cannot see you. He can only listen to your audio. So that means your voice should be as confident as I am right now. You should be very confident from your voice. So what gives confidence to your voice is your loudness and fluency. Loudness does not mean that you become over loud. I am teaching you all. That is why I am so loud. But it does not mean that you should be over loud. Means you are talking to a person, so tone should be like this. Good morning. My name is Bhupesh. I am a nurse over here. How may I help you? So that is how you speak. And then it comes to fluency. Fluency is very important skill when it comes to writing. Grammar and data selection are the two important things when it comes to speaking. Loudness and fluency. Even if you commit couple of mistakes in the grammar, that's fine in speaking. Don't worry about couple of mistakes or five mistakes even speaking in terms of grammar. Second most important thing why people miss out on marks is that sometimes they try to follow the role play. Like if I show you this role play, so they will try to cover the points one, two, three. No, rather than covering the points, it is more important to listen to the patient and to answer the patient. Suppose if by chance patient is asking about how to administer the medication, then talk about this point first, or otherwise you need to say, I'm really sorry to say, first of all, I think first of all it is important to ask you that whether you are taking the medications or not. Then I will tell you about administering the medications. Is it fine with you? So you take the consent of the patient that you are not giving him the answer, that is it fine with you, should I explain you that thing first because it is more important, or it has to be asked first. Suppose if somebody is asking about administering the medication, before that you would like to know about the condition of the patient. So you say, I'm really sorry. First of all, I need to ask about your condition. Then we will talk about the medication. Is it okay with you? Because first, if I know your condition, I would be able to tell you better about the medications. Is it fine? So that is how you take the permission. Please pause it, listen to this line again and again, practice to speak this line, because that will help you to bring to the point again. Otherwise, try to cover the point which patient is asking first. Because see, it is a conversation. If you are not giving the right answer to patient, then why are you even having this role play? The main purpose of this role play is to satisfy the patient. So always keep at the back of your mind that satisfaction of the patient is the most important thing. This gives you maximum marks. So don't break the conversation. We cannot break the loudness, done, fluency, done, conversation on the mark, grammatical mistakes, okay, you will pass. Loudness, fluency, conversation, you will pass. The last thing, when we are talking about the last very thing, what is the most important thing? So in the final exam, these gestures, these video will not matter. So I am leaving it over here. I am stopping my video so that you can listen to my audio. So loudness, fluency, and then not breaking the conversation. And one of the most important thing in the last is to summarize the task. This is the last important part of getting more than 400 points. If you want to score more than 400, For A grade in speaking, this is the secret. Loudness, fluency, conversation, and last में overall, you want to say overall, or you say now I yeah in I would like to highlight the key points. So that is how you can do. Points that if you will take the proper medications, then you will be fine. That if you will take proper medications or follow our instructions, proper medications, and follow our instructions, you will be fine. Means you always try to end the role play in a way that patient, you give assurance to patient that you will be fine. That is the main thing, that you end the role play always at a positive note that you will be fine. But if it is an end stage patient having maybe the cancer, terminal illness, then you say, don't worry, we all are here to help you. And I would like to reassure you that we will try our level best to take care of you. So we will try our level best to take care of you. So you can't say to the terminal patient having cancer and stage cancer that you will be fine. So you say that we will try our level best to take care of you. These are the important points you should consider. So now, again summarizing: loudness, fluency, not breaking the conversation, taking consent of the patient. If you want to examine the patient, you say, you don't have to act. Never act in OET role play. It is all your voice, because if sometimes if some people do not know about it, so they start acting. Okay, let me examine you. There is no point for video. So please do not act. There is no point of acting. Please understand. So you just have to say, okay, let me examine you first. After examination, I have found. So how do you do examination? All right, Miss. All right, John. So I need to examine you. Okay. May I have the consent to examine you? Okay. After examination, I have found that you are having this thing. That's it. I hope you all understand these important points of speaking. These are very, very important to be followed. And the most important thing again, if by chance you do not understand this point, suppose, sir, I did not understand this point, first one, don't talk about this point. Even then, you will have no deduction of marks. Means in OET, you don't have to cover the all points. Suppose you are in the end of your role play, then and you are not able to cover this point, then summarization is more important than covering the last point. Summarizing the task is more important than covering the last point. You cannot pass without summarizing the task or saying, I would like to highlight the key points and I would like to reassure you that there is nothing to worry, you will be fine. I would like to highlight the key points that if you take the proper medications, you will be fine. To the patient having the termination, I would like to reassure you that we will try to take the best care of you. So this is how you do it. Please don't miss out on any of the things. Otherwise, you won't pass. So these all important points should be covered: loudness, fluency, summarizing, and this. All good. Now there is another thing which I have recently seen in one of the authentic sites of OET. Otherwise, I normally say that if you follow our videos, you don't have to care about the authentic site even. But there is one point which I could notice is different, and I really wanted to tell you that if you ask the name of the patient in the start, so you ask, could you please tell me your name? If patient says my name is John, then then you don't call him Mr. John. You call him John only. That is a very special thing which I recently listened to, but I still will say, if you will say Mr. John, it will not impact you. So you say, could you please tell me your name or what can I call you? So he will say, you can call me John. You can call me John. So in that case, you will say, okay, John, let me explain you. What I mean by this, you should not say, okay, Mr. John. Means don't put Mr. If he says, please call me John, then call him John. Don't call Mr. John. That is the new thing I have learned. But I still believe this is the only thing I have learned in all these 11 years from somebody. But still, I believe that if you say Mr. John, still you will get all the marks. There is nothing to worry. Still, you will get all the marks. There is nothing to worry. So, but if you can try, so if the patient calls you, all right, please call me Maria. So you say, okay, Maria, now I would like to take care of you. So this is what I don't say, okay, Mrs. Maria or Miss Maria. Okay, Maria, I'm going to take care of you. So these are the important points of the speaking. I hope you all understood that how to score 350 or 450. But some people lack few points. So these are the points: loudness, fluency, summarization. And now I would like to give you an example of a role play. So this role play is in the pediatric walk. These role plays are much difficult when you are talking to the third person. Third person means that other than the patient, because in this case, you are talking to the mother. So she is third person. Patient is baby. I don't know for sure, but pediatrics means baby or a child. That is why I say OET cannot be taught if you are not a medical professional. You should always take coaching from a medical professional. That is why I say pediatric. How would non-medical student, commerce student, art student speaking good English will teach you OET and it doesn't know what is pediatrics? So please understand these basic things. So pediatric means kid. Kid means now you are talking to the mother. Mother is the third person. So that you are speaking with the mother of a 13-year-old boy named Adin who had an appendectomy by open surgery yesterday and is due for discharge tomorrow. So yesterday had the surgery and going for the discharge tomorrow. So going for the discharge tomorrow. Okay. He is on Tylenol for the pain. Tylenol, it's like paracetamol. It's an alternative to paracetamol as far as I think. But again, you don't need to know it. So he is on Tylenol. His recovery at home is expected to take between 10 to 20 days. The parent appears anxious about the child condition. So now the parents are anxious. Oh my God, what is happening to my child? He had this appendectomy. He would be discharged tomorrow. So that is the concern of the patient. Ask the parent if she has question or concerns about the boy's condition. So first of all, what you need to do, good morning. My name is Bhupesh. I am a nurse over here. And I am glad to inform you that your kid, your child will be discharged tomorrow. Oh, nurse, thank you very much for this news that my child would be discharged tomorrow. But I'm really worried about the concerns. I'm worried about how would we take care of him because he recently went operation. So underwent operation. We don't know how to take care of him. So first of all, you said, don't worry. We all are here to guide you. We will guide you with everything before we discharge your child. So we will explain you everything, how to take care of your child. So this is the main point of conversation. So don't worry about this point. Worry about that how to handle the patient. The main thing for a medical professional is to handle the emotional component. So you reassure the patient about Aden's pain. So you can tell, yes, there would be some kind of pain, but for the pain, we have already prescribed the medication or doctor has already prescribed the medication, Tylenol. Explain that appendectomy is a standard procedure and his current level of pain is normal. So you say that my child is complaining about the pain. Then being a nurse, you tell, see, please try and understand that appendectomy is a very standard procedure. And after this procedure, this kind of a pain is normal. So there is nothing to worry. And I want to reassure you that your child does not need to stay in the hospital. It is not necessary. Your child means third person. That is why this does is very important. So the one mistake when it comes to third person task is you can do your child do not need to stay. No, your child means he or she. He or she does not. Your child does not. So when you will speak your child does not, this will give you that 400 or 450. This gives you grades. Your grammar, but if you say your child do not need to stay, they will not fail you. But if we will repeat again and again, your child do not, your child, this will become notice, and that's where he might give you 340. So that is why some grammar you should know. Repetition of the mistake should not be done. So you should know the rules. Your child means he or she. That is what is third party task. In third party task, rather than do, you use does. So suppose if some parent is there, you are talking to the parent's son and you want to ask about his father. So you say, does he smoke? You don't say, do he smoke? Does he smoke? So this gives you marks. So your child is having this and your child does not need to stay in the hospital. Explain to the parent how to administer his medication. So explain that you need to give the medication by oral means or whatever would be given. What he should do if the pain worsens. I don't know, but if it comes in the final task, they will give you what to do, like to bring the patient back to bring him back to hospital or to give him extra dose of medication. If it comes in the exam, it would be given in the brackets, give extra dose of medication, give the medication 3 times. It would be given in the bracket. So you don't have to say anything from your side. If it comes in the final exam, in the brackets, it would be given that you can increase the dose or whatever. Answer the parent question about the Eden's planned activities after he returns home. So give sympathetic but professional advice on this issue. Be firm about Eden restricting his physical activity for the next 2 weeks. Again, if it comes in the exam and if they talk about planned activities, then planned activities will be given in the bracket that take him to park, engage him in the normal activities, play games with him like Ludo or something that would be given. So don't worry about this kind of a task. In the final exam, you will get everything. But the main point that they have given is be firm that you cannot take the child out for the physical activity for the first 2-3 weeks. Conclude by summing up recommended post-operative care, wishing the boy a quick recovery. So if by chance you have not been able to cover this role play, obviously even I cannot cover this role play because the points are not given in detail. But if it comes in the final exam, all the points would be given. But generally to cover this task, how to do, I'm just trying one shot. I don't know how much time would I be able to cover, but I will tell you how to do it. So I will do. Good morning, this is Bhupesh. I am a nurse over here in this pediatric ward and I am taking care of your child today. So first of all, I would like to ask you, how are you? I am fine, nurse. I'm just worried about my son, Eden. Oh, I'm here for your son, Eden only, and you don't have to worry about Eden. He is absolutely fine. He is having bit of a pain, which is a common thing that happens after the standard procedure of appendectomy. So your child is having bit of pain, but there is nothing to worry at all because doctor has already prescribed the medication. The name of the medication is Tylenol. So whenever your child experiences experiences any kind of pain at home, that you can give this medication. Oh nurse, can I say you something? Of course, please, you can tell me everything and I will try to answer each and every problem you are facing or any issue that you are having. So you can ask me everything. Oh, thank you, nurse, for giving me consent. Nurse, see, I'm really worried that do you think that we should take Eden home? Because it's just yesterday he had an operation and now your doctor is telling that he will be discharged tomorrow. I'm really worried about it. See, I totally understand, Maria, that you are concerned about your son Eden and you think that he should stay in the hospital. But I would like to tell you that appendectomy is a very standard procedure and he does not require any kind of longer stay. Longer stay is required for the major surgeries. But appendectomy is just a standard procedure. You don't have to worry about anything because we normally discharge the child after this operation. So doctor has made the right decision and you don't have to worry about it. Again, I would like to tell you that he might feel the pain, but for the pain, doctor has already prescribed the medication and you need to give the medication according to the recommended dosage and time. So would you be able to give medication to your son on time? This is how you ask. Would you be able to give the medication on time? Yes, nurse, of course. Well, that's good to know. Then I assure you that there is nothing to worry. So now I would like to tell you how to administer the medication. So as you know, your son is not going through this oral route or whatever things, or otherwise you can give the, again, I'm saying if it is in the exam, it would be given that you should give the medication, one medication at time in the morning or in the evening, according to whenever he feels the pains. If there is any worsening of the pain, then you should immediately contact us and we will give you a leaflet which will contain our number and you can contact us on that number. Would that be fine with you? Maria? All right. Or Mrs. Maria, because she has not told me whether to call Miss Maria or Mrs. Maria. So you said, would that be fine with you, Mrs. Maria? Done. So now I would also like, sometimes examiner would be reluctant. This is the main thing again. So don't stop. You say, would that be fine, Mrs. Maria? Okay. So the next thing I would like to, so you take the initiative yourself. Okay. The next thing I would like to tell you about the add-ins planned activities after he returns home. So I would like to tell you that you need to talk to him all the time and engage him in the activities which do not require physical strength, because I want to tell you that doctor has strictly told that Aiden should not perform any kind of physical activity for next 2 to 3 weeks, because it's really important for him to restrict or to avoid physical activities. So are you understanding me, Mrs. Maria? Okay, that's great. Good to know that you are understanding every point. And now I would like to summarize the whole conversation again, and I would like to highlight the key points that Adin would be having bit of pain, but that will subside with the medication which doctor has prescribed. And if it worsens, then you should increase the dosage. And please do not take him to any physical activity for the next 2 to 3 weeks. And I reassure you that he will be fine if you follow all the instructions. Here is a leaflet. It contains all the information what we have discussed, and also there is a number on the leaflet on which you can contact if there is anything that you do not understand. Is it okay, Mrs. Maria? All right, nurse. Okay, then take care. Now the last problem which can happen, last problem which somebody can commit as a mistake that can also lead to failure is, okay, take care and we'll see you soon. Never say we'll see you soon. We doctors and nurses do not welcome our patients in a way that I would like to see you soon in the hospital. So you don't do that. That is the last bit of point I would like to cover. So sometimes you might have performed very well, but the last thing you would have said, okay, take care, bye bye, see you soon. Don't say that. If by chance it comes out of your mouth, don't worry. Then do not, because it's spoken. You can't do anything. Don't think negative now. But please do not say. You just say, okay, then take care of yourself. And if you need anything, please let us know. Last line. If you need anything, please let us know. If you need anything, please let us know. Thank you. That's it. This is Dr. Bhupesh. Please subscribe our channel if you have not. And our contact number is 76967342256 for the best OIT coaching. Thank you.